Welcome to today's video about symptoms of epilepsy. What if I told you that millions of people are living with a condition without even knowing it? A condition that can strike at any moment, whether you're at work, at school, or even asleep. And the scariest part, some of the signs are so subtle, they're often ignored until it's too late. Epilepsy, one of the most misunderstood neurological disorders, affects over 50 million people worldwide. But did you know seizures aren't always what they seem? Some don't even involve convulsions at all. Some signs may appear in your stomach, your emotions, or even your memory. And if you miss them, the consequences can be life-changing. Have you ever felt an unusual wave of fear for no reason? Experienced sudden déjà vu? Or maybe your body twitches uncontrollably, even when you're awake. Could these be warning signs of epilepsy? Or just something harmless? In this video, we're diving deep into 13 scientifically proven symptoms of epilepsy, backed by research. We'll separate the facts from the myths, share real-life stories, and most importantly, help you understand when it's time to seek medical advice. Don't miss a single second. Let's begin. Please note, this video is for informational purposes only and is not a replacement for professional medical advice, diagnosis, or treatment. Always consult a healthcare provider for any medical concerns. All research information shared here has been verified by researchers. You can find all references to the studies mentioned in the description below. All right, let's dive straight into the symptoms of epilepsy, starting with the first one on our list. Convulsions. Epilepsy manifests in various ways, and one of the most noticeable signs is the occurrence of convulsions. These convulsions are sudden, involuntary muscle contractions resulting from abnormal electrical activity in the brain. When neurons fire excessively and synchronously, it disrupts normal brain function, leading to these uncontrollable movements. Convulsions can vary significantly among individuals. Some may experience brief muscle twitches, while others might undergo prolonged episodes of vigorous shaking. The duration and intensity of these convulsions often depend on the type of seizure and the specific brain regions involved. A recent study published in Acta Epileptologica in 2023 highlighted the impact of convulsive seizures on patients' quality of life. The research emphasized the importance of early diagnosis and tailored treatment plans to manage convulsions effectively, thereby improving daily functioning and overall well-being. Recognizing convulsions as a symptom of epilepsy is crucial. It not only aids in timely medical intervention, but also helps in understanding the challenges faced by those living with the condition. By raising awareness and promoting research, we can work towards better management strategies and support systems for individuals affected by epilepsy. Next, number 2. Staring spells. Experiencing episodes where someone suddenly seems to zone out can be concerning. These episodes, often referred to as staring spells, might be more than just daydreaming. They could be indicative of absence seizures, a form of epilepsy. During an absence seizure, a person may appear to stare blankly into space for a few seconds, and then quickly return to their previous activity, often unaware that the episode occurred. It's essential to differentiate between epileptic and non-epileptic staring spells. A study published in the Journal of Child Neurology in 2022 examined children referred to a seizure clinic for staring spells. The researchers found that 49% of these children were diagnosed with epileptic seizures, while 51% had non-epileptic events. Notably, children with non-epileptic staring spells were generally younger and more likely to have developmental delays. The study highlighted the importance of using both clinical history and electroencephalography findings to distinguish between these types of events. Recognizing the signs of absence seizures is crucial. These seizures are characterized by a sudden halt in activity, a blank stare, and sometimes subtle movements like eye blinking or lip smacking. They typically last only a few seconds and can occur multiple times a day, which might be mistaken for inattentiveness or daydreaming. If you observe such episodes, especially if they happen frequently, it's important to consult a healthcare professional. Early diagnosis and appropriate treatment can help manage symptoms effectively and improve quality of life. Next, number 3. Loss of consciousness. Experiencing a sudden blackout can be one of the most unsettling aspects of epilepsy. This abrupt loss of consciousness happens when a seizure disrupts the brain's normal electrical activity, leading to a temporary shutdown of awareness. It's not just about fainting. During these episodes, individuals might also experience muscle stiffening or jerking, and once they regain consciousness, confusion often follows. This can be particularly dangerous, especially if it occurs during activities like driving or swimming. Recent research has shed light on why this happens. A study published in Cell Reports in December 2024 by Yale researchers found that during temporal lobe seizures, there's a significant reduction in activity within certain brain networks responsible for maintaining consciousness. This decrease in activity correlates directly with the periods when individuals lose awareness during a seizure. Understanding these mechanisms is crucial. By pinpointing the exact changes in brain activity that lead to loss of consciousness, scientists hope to develop targeted treatments. The goal is to prevent these episodes, allowing individuals with epilepsy to lead safer and more independent lives. It's a step forward in making the unpredictable nature of epilepsy a bit more manageable for those affected. Next, number 4. Sudden muscle stiffness. Experiencing sudden muscle stiffness can be a clear indicator of epilepsy. This stiffness, known as a tonic seizure, involves an abrupt increase in muscle tone, causing parts of your body, like the arms, legs, or trunk, to become rigid. These episodes are typically brief, often lasting less than 20 seconds, and frequently occur during sleep. If you're standing when one strikes, the sudden rigidity might lead to a fall. Recent research has shed light on the characteristics of tonic seizures. A study published in Acta Epileptologica in August 2024 analyzed 32 patients experiencing tonic spasms. The findings revealed that these seizures often occur in clusters, with an average of nearly 7 episodes recorded during 24-hour video EEG monitoring. This pattern underscores the importance of recognizing and monitoring such symptoms for effective management. Understanding these signs is crucial. If you or someone you know experiences sudden muscle stiffness, especially if it leads to falls or occurs during sleep, it's essential to consult a healthcare professional. Early recognition and intervention can make a significant difference in managing epilepsy effectively. Next, number 5. Sudden muscle weakness. In epilepsy, certain seizures can lead to a sudden loss of muscle tone, causing individuals to collapse abruptly. These episodes, known as atonic seizures or drop attacks, are brief, but can result in injuries due to unexpected falls. Atonic seizures are characterized by a sudden decrease in muscle tone, leading to head nodding or complete body collapse. This loss of muscle control is typically short-lived, lasting only a few seconds, but it poses significant safety concerns. Recent research published in the journal Seizure, 2024, highlights the challenges in diagnosing and managing atonic seizures due to their brief nature and the potential for misinterpretation as other conditions. The study emphasizes the importance of accurate diagnosis to implement effective treatment strategies. Understanding the manifestation of atonic seizures is crucial for ensuring safety and appropriate medical intervention. If you or someone you know experiences sudden episodes of muscle weakness or unexpected falls, it's essential to consult a healthcare professional for proper evaluation and management. Next, Number 6. Repetitive movements. Automatisms are involuntary, repetitive movements that can occur during certain types of seizures, particularly in temporal lobe epilepsy. These movements often resemble natural behaviors, but are performed without conscious awareness. Common examples include lip smacking, chewing, or hand movements. During a seizure, normal brain activity is disrupted, leading to these automatic behaviors. A study published in Seizure, 2021, examined the clinical features of automatisms and their correlation with seizure types. The researchers found that automatisms are defined by coordinated motor activity occurring with impaired cognition and are often followed by amnesia. Oral and manual automatisms were identified as the most common types. Understanding these involuntary movements is crucial for accurate diagnosis and treatment of epilepsy. Recognizing automatisms can help differentiate between seizure types and inform appropriate therapeutic strategies. If you or someone you know exhibits such behaviors, it's important to consult a healthcare professional for proper evaluation. Next, number 7. Aura. In epilepsy, an aura is a distinct experience that occurs at the onset of a seizure, serving as an early warning sign. These sensations are highly individualized and can manifest in various forms, such as unusual smells, tastes, visual disturbances, or sudden emotional shifts like fear or déjà vu. Essentially, an aura represents a focal aware seizure, indicating that the seizure activity is limited to a specific area of the brain while the person remains conscious. Understanding auras is crucial for both patients and healthcare providers. For individuals with epilepsy, recognizing an aura can provide a brief window to ensure safety before a potential progression to a more intense seizure. From a medical perspective, the specific characteristics of an aura offer valuable insights into the localization of the seizure onset within the brain. For instance, visual auras may suggest involvement of the occipital lobe, while auditory auras could indicate the temporal lobe's participation. Recent research underscores the significance of auras in epilepsy management. A study published in the Journal of Headache and Pain in 2025 proposes an etiology-based classification for auras, emphasizing that while commonly associated with migraines, auras also occur in various neurological disorders, including epilepsy. This classification aims to enhance diagnostic precision and treatment strategies by acknowledging the diverse origins of aura phenomena. By paying close attention to auras, individuals with epilepsy can better anticipate seizures, and healthcare providers can tailor interventions more effectively, ultimately improving patient outcomes. Next, number 8. Memory loss. Living with epilepsy often means dealing with memory challenges. Seizures, especially those originating in the temporal lobe, can disrupt the brain's normal processes, leading to difficulties in forming or recalling memories. For instance, during a seizure, the hippocampus, a region crucial for memory, may not function properly, affecting how memories are stored. It's not just the seizures themselves. The electrical disturbances in the brain can interfere with memory consolidation, the process where short-term memories become long-term. This means that even events you thought you'd remember can fade more quickly than usual. Medications prescribed to control seizures might also play a role. Some anti-epileptic drugs have side effects that include memory issues, adding another layer to the challenges faced. Balancing effective seizure control with minimal side effects is a common goal in treatment plans. Recent research has shed light on these issues. A study published in the journal Seizure in 2024 explored how different types of epilepsy affect various memory functions. The findings suggest that certain forms of epilepsy may impact specific memory types more than others, highlighting the need for tailored approaches in managing memory concerns. Understanding these connections is vital. By recognizing how epilepsy influences memory, individuals and healthcare providers can work together to develop strategies that address these challenges, improving quality of life. Next, number 9. Hallucinations. When discussing epilepsy, it's essential to recognize that seizures can sometimes lead to hallucinations, sensory experiences without an external stimulus. These hallucinations often arise from abnormal electrical discharges in specific brain regions. For instance, during temporal lobe seizures, individuals might perceive complex visual scenes, hear non-existent sounds, or even detect phantom smells. This occurs because the temporal lobe plays a pivotal role in processing sensory information and memory. Recent research has shed light on the brain circuits involved in such phenomena. A study published in the Proceedings of the National Academy of Sciences in December 2024 explored how disruptions in the communication between the motor and auditory cortices can lead to auditory hallucinations. While this study primarily focused on schizophrenia, the findings are relevant to epilepsy, as similar neural pathways may be implicated. Understanding these connections helps explain why some individuals with epilepsy experience hallucinations during seizures. It's important to note that the type of hallucination often depends on the seizure's origin within the brain. For example, occipital lobe seizures might produce simple visual hallucinations, such as seeing flashing lights or geometric shapes. In contrast, temporal lobe seizures can result in more elaborate visual or auditory experiences. Recognizing these patterns not only aids in accurate diagnosis, but also guides effective treatment strategies. Next, number 10. Sudden anxiety or fear. Individuals with epilepsy may experience sudden feelings of anxiety or fear, which can manifest in various ways. These episodes might occur just before a seizure, during a seizure, or after a seizure. For instance, some people report an overwhelming sense of dread moments before a seizure begins, serving as a warning sign. During a seizure, especially those originating in the temporal lobe, intense fear can be a primary symptom. After a seizure, lingering anxiety is also common. Research has shown a significant connection between epilepsy and anxiety disorders. A study published in Current Psychiatry Reports in 2019 highlighted that anxiety symptoms are often periictal, meaning they occur around the time of seizures. The study emphasized the importance of recognizing and treating these anxiety symptoms to improve the quality of life for individuals with epilepsy. Understanding these anxiety episodes is crucial for managing epilepsy effectively. By identifying patterns and triggers, individuals can work with healthcare providers to develop comprehensive treatment plans that address both seizures and associated anxiety, leading to better overall well-being. Next, number 11. Uncontrollable laughter or crying. In certain rare cases, epilepsy manifests through sudden, involuntary episodes of laughter or crying, known as gelastic and dichristic seizures, respectively. These episodes are typically brief, lasting less than a minute, and occur without any apparent external trigger or emotional context. Individuals may laugh or cry uncontrollably, often with a tone that seems forced or unnatural. During these seizures, other symptoms like facial twitching, unusual eye movements, or repetitive behaviors such as lip smacking can also occur. Despite the outward expression of emotion, the person may not actually feel happy or sad during the event. Recent research has shed light on the neurological underpinnings of these seizures. A comprehensive review published in Epilepsy and Behavior in 2023 highlighted that gelastic seizures are often linked to hypothalamic hamartomas, benign tumors located in the hypothalamus region of the brain. These growths can disrupt normal brain activity, leading to the inappropriate emotional expressions seen in gelastic and dichristic seizures. The study emphasized the importance of advanced imaging techniques in accurately diagnosing these conditions, as early detection can significantly influence treatment outcomes. Understanding these unique manifestations of epilepsy is crucial for timely diagnosis and effective management. If you or someone you know experiences such episodes, it's essential to consult a healthcare professional for a thorough evaluation and appropriate intervention. Next, number 12. Sweating, rapid heartbeat, or flushing. When we think about epilepsy, seizures often come to mind. However, it's important to recognize that epilepsy can also affect the autonomic nervous system, leading to symptoms like sweating, rapid heartbeat, and flushing. These manifestations are known as autonomic seizures. During an autonomic seizure, the brain's normal regulation of involuntary bodily functions is disrupted. This disruption can cause excessive sweating, a racing heart, or sudden skin flushing. Such symptoms might be mistaken for other conditions, but when they occur in conjunction with other seizure signs, they can indicate epilepsy. A study published in Clinical Autonomic Research in 2019 highlighted that cardiovascular manifestations, including changes in heart rate and skin conductance, which relates to sweating, are prominent during seizures. This underscores the significant role of the autonomic nervous system in epilepsy. Recognizing these autonomic symptoms is crucial. If you or someone you know experiences unexplained episodes of sweating, rapid heartbeat, or flushing, especially alongside other neurological signs, it's essential to consult a healthcare professional. Early identification and management can greatly improve quality of life. Next, number 13. Gastrointestinal sensations. Epilepsy doesn't just manifest as seizures. It can also present with gastrointestinal symptoms, which might surprise many. These symptoms include abdominal pain, nausea, vomiting, and even constipation. Such manifestations are particularly noted in conditions like abdominal epilepsy, where GI disturbances are prominent. Recent research has delved into the connection between epilepsy and the gut. A study published in Frontiers in Neurology in 2021 found that individuals with epilepsy had a higher prevalence of functional gastrointestinal disorders, or FGID, compared to healthy subjects. Notably, constipation was the most common FGID observed. This suggests a significant link between seizure activity and gastrointestinal function. The gut-brain axis plays a crucial role here. This bidirectional communication system means that disruptions in the gut can influence brain activity and vice versa. In epilepsy, abnormal brain discharges might affect the autonomic nervous system, leading to GI symptoms. Conversely, GI disturbances can potentially exacerbate seizure activity, creating a challenging cycle for those affected. Understanding this connection is vital. For individuals with epilepsy experiencing unexplained GI symptoms, it's essential to discuss these with healthcare providers. Addressing both neurological and gastrointestinal aspects can lead to more comprehensive care and improved quality of life. And that's it for today's video. I hope you found this information eye-opening and valuable. Epilepsy is often misunderstood, but awareness can truly make a difference. Now, I want to hear from you. If this video was helpful, type "helpful" in the comments below. Your feedback keeps us motivated to create more life-changing content like this. Don't forget to subscribe and hit the bell icon so you never miss an important health update. Stay informed, stay healthy, and I'll see you in the next video.